everyone, this is Marika from Hemisphere, and I just really wanted to talk very quickly about pelvic girdle pain. Now, within my exercise classes and in the online program, we obviously go into pelvic girdle pain in a lot more detail, but I really wanted just to touch on a couple of tips this week that clients have come back to me and said have been really, really useful. So sometimes pelvic girdle pain can be really quite complex, and we'll use exercise and manual therapy as a really good management tool. But I was reminded again of just how some simple changes can really help people's pain. So I just wanted to quickly run through the two that came up this week that my clients said were really, really helpful. So one of the things that I recommend for ladies who have pelvic girdle pain is to just monitor how they're sleeping and think about the positioning in particular of the top leg. So what I find is, and I'm hoping this is going to work, so when you fall asleep, often what will happen, and yes, I have my boots on, so you'll be sleeping away and this top leg will commonly fall across, and women will start to feel pain either in the sacroiliac joint, sort of coming across into the butt, or they might get that pain in the pubic symphysis. They might feel okay for a little bit, and then after a period of time it'll wake them up, and then typically rolling over is an absolute nightmare. It's kind of, really, really painful. So what I suggest to women is to try and use cushions and pillows to keep that top knee up level with the hip. So it can work like this. So putting a couple of pillows between or cushions between the knees just to elevate that top knee. Or if you are someone who likes to have that top leg over, is to get more cushions. And I joke around that you might have to kick your partner into the spare room because you've got all your pillows and things there. But ultimately, you might need even 2 or 3 pillows just to support that top leg. There are lots of pregnancy cushions as well that you can get these days. But really what you're aiming for is getting that knee in line with the hip and stopping it from dropping over the top like that. So, that's one of the common tips that I give to my clients. And I had a lady last week who was having a lot of pain rolling over in bed. She was having pubic symphysis pain, and she said, "Oh, I tried that pillow thing and I'm not having it anymore." So definitely give that a try if you're having pain with sleeping or rolling over in bed. When you roll over in bed, glue your knees together and try and roll like a log, because sometimes it's just that sort of torsion, that twisting through the pelvis with one leg going one way, and that can be what causes some of those symptoms. The other tip that came up this week that another client found was really, really beneficial was actually shortening the stride with walking. So this particular client, she had pubic symphysis pain, and I just mentioned, she does the online program, and she heard that one of the tips that I give is to imagine that you're wearing a mini skirt if you're getting pain with walking, and just shorten your stride a little bit. And she said, "Oh wow, I tried that last week and my walking is so much better. I'm so much more comfortable." So I just wanted to quickly go through those tips because I think sometimes, we can overcomplicate things, and sometimes just taking those little tiny tips can really help relieve people's pain. So if you're having pelvic girdle pain, give those a go. If you want to learn more, visit the website. I will be putting up a lot more information about pelvic girdle pain, but obviously if you join the pregnancy program, we have a full talk about pelvic girdle pain and some of the causes and so all the tips and tricks that you can use to help with that. I'd really encourage you to go and see a physical therapist close to wherever you are located if you're having pain, because I do find that a little bit of manual therapy, so a little bit of, it could be deep tissue release, a bit of manipulation, gentle mobilization. It's different for different people, but I do find that can be really beneficial, and then just getting straight back into those exercises as soon as possible. And I do have a lot of modifications within the exercise program, the exercise club for people with pelvic girdle pain. So a lot of the exercises are modified because I know from running lots of classes, certain exercises are more irritable than others. So I've just given some adaptations in there to help you along the way. But hope this helps, and feel free to email me, marika@herisphere.net.